Hello, this is Dr. Marty Klein with more Sexual Intelligence. Today I'd like to talk about the very important question of, is your therapist giving you bad advice when it comes to sex? Chances are your therapist received almost no clinical training in human sexuality. In fact, there are very few human activities that therapists get less training in. As we know, Western culture is full of ambivalence, fear, and misinformation when it comes to sex. Therefore, we shouldn't be surprised if your therapist has absorbed a lot of that negativity, since it probably wasn't challenged during their training. When you add in a strong dose of today's political correctness, therapy customers need to be careful, especially if their concerns are sexual. Here are examples of what many therapists think they know about sex, but they're wrong. And the first is the idea that interest in kink reflects childhood abuse. About 25 years ago, America's general awareness of kinky sex began to increase as a result of two main things: the mainstreaming of homosexuality and the spread of broadband internet, pornography and social media. Each of these brought non-standard sexual arrangements into public consciousness. Broadly defined, kink often involves playing with taboos or power dynamics. Participants give themselves permission to fantasize sexually, whether that involves costumes, equipment, role-playing, or exploring what might feel good, even if that isn't what it looks like from the outside. Since most therapists get no training in any of this, they may react to descriptions that sound masochistic, sadistic, confusing, or just plain weird. Instead of asking patients what it feels like to spank or be spanked, they may simply observe, "It sounds like abuse to me, so I'll treat it like secondhand abuse." Many therapists feel comfortable working with abuse or trauma, so they're more comfortable seeing kinky sex that way, rather than expanding their own concepts around eroticism, lust, and pleasure. Well, here's another incorrect belief of many therapists. To resolve infidelity, the cheater must reveal every moment of what they did. Now, someone who's been cheated on needs comfort. Their reality has been destabilized, so they need information. They need a sense of what to expect going forward, so they need ongoing, dependable communication. What they don't need, no matter how much they demand it, is a long series of tiny details. Where did you two do it? Which positions? Did you use lube? Did you shower together? What restaurants did you go to? Therapists should understand that somebody asking a million questions like this might not be the best judge of what they need. But if a therapist is judgmental, if they imagine that infidelity involves one selfish evildoer and one innocent victim, they won't think clearly either. Will they ask if the victim had withdrawn sexually? If they were sympathetic to the cheater's concerns about aging or changes in their body? If the couple were physically connected in non-sexual ways? More importantly, will the therapist ask, why do you want to know if, say, the cheater was listening to music during cheating sex? Because a neutral, objective therapist will know that there's no good reason to ask or answer a question like that. Here's another clinical myth about sexuality. A woman has a right to a porn-free home. This raises a bigger issue. How are couples supposed to navigate values differences? To put it another way, what are legitimate ways to use power within a couple? If a couple votes on an issue and it's a 1-1 tie, what do? Say Joe wants to eat Italian tonight while Kalpana wants to eat Chinese tonight. I don't care where they eat, but how they decide where to go, now that's a good predictor of how healthy the relationship is. So now let's go back to porn. Very few therapists would say he should get what he wants because he's insecure, or she should get what she wants because she's a woman. So if the couple votes and he wants to watch porn in private in their house and she doesn't want porn watched in the house, how do they resolve this? Where would anyone get the right to insist we have to do this my way, especially if that isn't the way a couple generally resolves conflict? As it happens, I have the right to a porn-free home generally means I don't want you watching porn at all, ever. That way of putting it at least is more honest, and it makes it clear that two people are just talking about, well, I want A and I want B. If two people ask each other enough questions about that, they then might actually understand each other a little better, even if they don't completely resolve their conflict. But in a relationship, the language of rights is very dangerous. Okay, one more myth. Men and women are basically different, especially about love and sex. On certain dimensions, the average man and the average woman are different. For example, if you ask 100 men how often they masturbate per month, and you get an average of those numbers, and you ask 100 women how often they masturbate, and you get an average of those numbers, if you compare the men's and the women's average number, the men's will almost always be higher. But no one is actually the average man or the average woman. So knowing that some anonymous person masturbates once a month or once a day does not tell us anything about their gender. Most adults of all genders want the same things from sex. They want to feel special, to feel connected, to feel competent, to feel pleasure. And most adults are anxious about the same sexual things: their performance, their attractiveness, their aging bodies, and being compared to other people. Focusing on the supposed differences between men and women is a common mistake that therapists make, especially when talking about sexuality. When patients ask me to explain men or explain women to them, I say, you don't need to know about men or women unless you're planning to have sex with thousands of men or thousands of women. Now, if you want to understand Jorge better, or if you want to understand Emily better, you should talk to an expert about them. And that would mean don't ask me, ask them. Well, I'm Dr. Marty Klein. Thanks for joining me today. And I drop one of these every 3 or 4 weeks, so if you want to get pinged when I do, just click subscribe, and don't forget to click like. I have about 75 or 85 of these in my YouTube library, so feel free to cruise whichever playlist strikes your fancy. I'll see you next time.